started. And I'd just like to introduce our moderator. Her name is Danetta Sloan, and she is a consultant working with the Center on Advanced Care Planning and Healthy Living Through Faith project, as well as a member of the African American Advanced Care Planning Network. So Danetta, I think you have a couple slides. Should I bring those up now?
Yes, you can, but I really want maybe to introduce the other panelists before.
Okay, sure. All right, first we've got Gloria Thomas Anderson. She's an advanced care planning expert and author of the African American Spiritual and Ethical Guide to End-of-Life Care and Toolkit. We also have Chris L. Brady, who's a pastor of Wilson Temple in North Carolina. And then also Mariset Hassan, President and CEO of the Carolinas Center in South Carolina.
Thank you. Thank you, Matthew. I could have said all of your names, but all of your titles, yes, I would have blended them a bit. So thank you very much for being with us today. And what I'm going to do right now is just set the context for our discussion. And by no means are we limited in our discussion. I'm just going to give a few details and how this came about and a starting point. So saying the distant goodbye during COVID-19, African American religious and spiritual perspectives. Slide, Matthew, please. So some general information here. We are all familiar, it's in the news, that African Americans make up 27% of the confirmed COVID-19 cases in the US, and we're only 13% of the American population. It's something like 13.4% of the American population. So when you think about that, that 27% is huge. We are overrepresented in hospitalizations with higher rates of death. A recent study that was just published ahead of print yesterday, thank you, Cindy, showed that in Louisiana, in a Louisiana medical system, they found that 76.9% of the patients hospitalized and 70.6% of those who died were non-Hispanic Blacks. That's just in Louisiana. And data is slowly coming out right now because previously no one was collecting the data. So now we're just beginning to take a closer look at just how large this disparity is. But we know that these are disparities that have existed, these type of disparities have existed in our healthcare system in the US for quite some time. So how does this relate to our discussion today? Well, we're looking at the deaths and the end-of-life situations we're going to discuss. A recent Pew Center survey that was conducted last month reports that coronavirus crises strengthen the faith in African Americans, specifically also looking at the historically Black churches. Now, not only in African Americans, I'm sorry, in all faith communities. But slide, please, Matthew. If we take a look at this slide, it'll give us a snapshot, if you can see it, of all of the different faiths. But to point your attention to the historically Black churches, as you can see here, our faith is increasing. So if we can bring that into our discussion a bit and how that impacts us. Slide, Matthew. We are going to talk to Mariset today about her experience in hospice and the lay faith community during COVID-19, and what some of the experiences that she's seen in that community. Gloria will bring in her experience and perspectives on interacting with people in the faith community. At large, Gloria is not only a licensed minister, but she is also a licensed social worker. And just to let you know, Mariset is also clergy. And then we have Pastor Brady as a leader of the church, as a leader of the church, and some of his experience and perspectives, especially the response to his responsibility to parishioners in his own church, but as a leader, parishioners at large. So thank you. Welcome all. I really appreciate you being able to be present and agreeing to do this. And let's start with Marissette first.
Okay. So where do you want me to begin? All of a sudden, the page went blank. I was
well,
like,
if you could just tell us about what you've been experiencing in the community as it relates to our Black community reacting or coping with COVID. What's happening toward, what do you see happening as we are unable to be with our loved ones, as they are being diagnosed with COVID, getting closer to death, transitioning, and how that's impacting what happens after death, and us being able to come together or not come together. Things like that. What has your experience been, and how has the clergy within hospice had to adjust to everything that's going on?
Thank you, Danetta. Now, you know, that's a lot there. You know, when you give preachers a platform, oh my God, I'm gonna try to be real quiet, not too long, so that my colleagues can be able to share. But I'll start first of all with the spiritual aspect. I am definitely encouraged to see the statistics that you showed when you started out about from the Pew Center, about how African-American churches are strengthened in their faith. And so I think from that perspective, because I am a person who's actively engaged in ministry in my church, supporting what our pastors are, you know, wanting to do, and working with our departments, that I see that is happening a lot. You know, Facebook Live sermons are going forth like never before. If we weren't into Facebook before, our pastors are now into Facebook. I mean, our church ramped up being able to touch the members in a meaningful way. So that meant that we did prayer calls, you know, on Tuesday and Friday nights, conference prayer calls. We now have life groups that happen virtually. We have Facebook Live sermons that happen Thursday nights and on Sundays. Whereas before, we were a church that met on Sundays, had a life group meeting on Wednesday, and then there weren't other touches. So I'm seeing that churches across our communities, particularly where I am, other churches are doing the same. Their pastors are coming on at odd times that you wouldn't normally see them, to touch the community and to touch their parishioners. And the other thing that's exciting is it's opened up a whole new world of outreach, because no longer are they just touching people in their church, but they're touching people in other states, and in some instances in other countries. We've had folks, you know, chime in to us from Bulgaria. We've had people chime in with us from Africa on some of our services. So it's an exciting time for the church to be able to get out a message of hope. And that is what I hear pastors doing a lot virtually, is really giving a message of hope to the church. Now, as it relates to our traditions, obviously there are churches who've experienced loss, and I'm a part of a parish nurse association, and many of them have died. And so the rituals that churches observe during this time, in all types of churches, we're used to in the South that when someone dies, you're going to take a casserole to the house. I mean, you are going to, I mean, we believe in the South that we're going to pray for you and we're going to feed you. And so not to be able to have the touch rituals that we're used to, those things have changed. And so now people are calling, they're texting. I just recently had 2 close friends whose mother and father died. And so not able to go to the home as we normally would. And graveside services now are more common. we typically in our community didn't do graveside funerals. I mean, you're going to come to the church, we're going to have the choir. I mean, we're going to march in, we're going to see the body on the way in, maybe on the way out. We're going to have a repast and connect, but all of that is different now. So even yesterday, there was a graveside service I attended, and I watched the proceedings from the car because it was raining. It was a large family. And they gave a message to everyone. We love you, but we're observing social distancing. So even though we're having a repast, we don't want you to come inside, drive by the church and tell us how many plates you need, and we'll bring it out to your car. That's how different it is for us now. Lastly, I would talk from the chaplains and social worker regulations for hospice providers does allow for us to have telephone communication with patients and their loved ones, but it's so different for us to do these things via telephone or being able to do sort of FaceTime. Our patients are older, so they're having to learn how to use technology. Some of them have it and some of them don't. So telephone communication and trying to provide support and to find out what their needs are is a lot different. We did have some families who didn't want our staff, providers to come into their homes for obvious reasons. And so we have had to be innovative. Some folks will go to the house and look through the window to talk to the patient, or to go to the nursing home and talk to them through the window at the nursing home. And so there are different ways now that we're having to provide that care and support at the end of life. When patients die now in the homes, it's different too, because funeral homes are doing different things to care for those patients who die at home. So hospice nurses who go into the home now may not just linger in the home when they go to the death of a patient. They're going to go back to their car, wait till the funeral home comes, then go back in, and obviously are observing all of the practices of wearing a mask and gowning up and having on gloves, etc. So it's different for us to provide that care. We're looking for ways to do bereavement care as well. You know, how do we engage communities virtually to provide bereavement support when we were used to doing face-to-face bereavement care and bereavement support groups that often happened in churches or in locations that were public to support those who were grieving. So it is a new time for us, and we're still learning how to adjust. And I think this is something that's not going to change quickly. So we're having to make those adjustments to provide that care. All right, I'm going to be quiet now. I did that in 6 minutes.
That's wonderful, and you'll have more time to circle back around. I apologize that I dumped it all on you at one time, but you know, I know you would have a lot to say. So thank you very much, Gloria. Thank you.
Oh, that pressure's off me now.
Thank you. I really appreciate that. And Gloria, can you tell me a little bit about, you know, what has your experience been during this time?
Yeah, sure. Most people know me as the advanced care planning person and then working as a professor in social work. But most people don't know that I'm a licensed minister. And so what I've been doing in this social distancing and sheltering in place, I asked God, you know, what can I do to make a difference where I'm at since I'm, you know, actively at home. And you might not know too that 30 some odd years ago, he gave me a ministry, a Christian ministry called Heart Tones. And it was to inspire And so what I've been doing is just letting that ministry come to fruition. Like you just said, Mary said about the bereavement support groups, because I've done a lot of work around grief and loss and done lots of work around just consoling souls. I have set up, and I didn't know what I was doing, but you know, had some help, but I set up a Facebook support group for encouragement. And I started it just about a month ago, and with just maybe 20 people, and it's over 200 people that have joined that community, which is really something I know God is going to use that for us to encourage each other, because when we can't connect, there, you know, you're right. We're used to going to the church. We're used to hugging. We're used to, you know, being there when somebody passes away. We're there with food. We're there consoling. And now we are just not able to do that with all of the concerns of COVID. And so this community is a way for people to stay connected. I also started something called Heart Talks with Dr. Gloria. And that is also on our YouTube channel. And what that is doing is I'm having guests that are in pastoral care and psychologists and people who have expertise in dealing with mental wellness and health. And so their interviews, it's coming from the heart. They're sharing personal things that will minister encouragement and healing to others. So that's my contribution. Because I've been a licensed minister for so many years, people also do call me and text me for prayer, because I have countless, oh my gosh, friends who have lost relatives and loved ones. And one young lady I talked with not long ago, she had lost her aunt to COVID. Her cousin found her unconscious on the floor, and they never saw her again. And so the family, they're traumatized. They weren't able to say goodbye. There's another young lady who contacted me for prayer who has lost, oh my gosh, she said 3 people had died, but about 25 people that she knew had contracted or had COVID. I can't imagine that, you know what I mean? Just the overwhelming, and then to be alone there, you know, not to have anybody to hug you and to support you. So yeah, it's something, but I'm glad to hear the statistics too, that churches are, you know, faith is getting stronger. We've lost a lot of pastors to COVID.
Yes.
You know, a lot of members, but you know, I'm grateful that, you know, that we're holding on to God in spite of what we don't see, what we don't understand. I'm grateful to know that people are having hope and that we're still making ways to connect and to show love and support to others.
Thank you so much for sharing your experience and the work that you're doing. I will circle back around to that later as well to see how can we, you know, get that information out to the broader community. Not to work you too hard, but. Pastor Brady, will you tell us about your experience as a
feel free
leader?
To call me Chris.
Thank you.
So thank you for inviting me to be part of the panel. And yes, my experiences thus far, I think at the early onset, the greatest thing I was able to do was provide kind of a non-anxious presence as the pastoral leader in my church and in the communities for which I operate, kind of setting that tone of diligence, watchfulness, precautions, but also we are people of faith. And so we also need to rest in the recognition that we believe in a source that is higher than ourselves at this point in time. And we need that, because what I've found is that my members and other folks I'm talking to, and even some pastor friends, are having to help people make meaning out of what is going on right now, and to establish a constant presence of hope for our congregations and our members. One of the things that we did at the onset, as soon as the stay-at-home order happened, I was able to negotiate and work with a Presbyterian church down the street from us, and we went into a collaboration with the USDA and Boston Market, and providing hot meals Saturday and Sundays for 1 hour. Boston Market cooks the food, they deliver it, and we set up in my church parking lot a drive-through line. You can also walk up. We have to date, since the 8 weeks we've been in operation, 9 weeks now, we have served over 2,800 hot meals to people in the Raleigh area. And then our food pantry was always ongoing, but we have seen an influx and just a wonderful outpouring from fellow churches, not just United Methodist churches, I'm a United Methodist pastor, but also our Baptist brothers and sisters, our Presbyterian brothers and sisters, because we happen to be a focal point of our the community, the Oberlin Cameron Village community in Raleigh, and one of the few churches in that area that is serving both food pantry hot meals simultaneously. And so for my members who are able and willing to come out, and we practice social distancing, the USDA had a procedure. We went through the training, we established it. But what it has done is, I have seen a change in an understanding of what it means to be a disciple of Christ. It is one thing to understand in our head and information-wise what we're supposed to do. But when church is closed and now you have to practice everything, orthopraxy becomes so important. And so, orthodoxy is great, but when you practice and you are the hands and feet of Christ, it makes meaning out of your faith in a different way.
Yes.
And that has been crucial to some of the practices. I'm also my training background is in marriage and family therapy. And so I also provide psychotherapy at a free clinic. And so I'm still doing telehealth and have increased that, extended that to some of my members, as well as I've taken on additional patients through the Alliance Medical Clinic that I work through. And particularly I see a lot of African-American children. So that has been an important for me in my ministry, but also an important outreach opportunity in the community. And just as my colleague said, we've, I've had a crash course, and I think I'm equipped to go national now in my preaching ministry. I've learned how to manipulate iMovie and all of these things. I'll tell you a real quick story, and I want to prove Maricette wrong, that when you give the mic to a preacher, they won't go forever. But my wife in August purchased for me as an anniversary gift, our 20th, a MacBook Air, and I have always used a Lenovo IBM. And so I looked at it, it's nice, it's beautiful, it's thin, and I just left it in the corner. Lo and behold, this thing hit, and I had to pull it out to start doing videos to produce for services. And I woke up about the weekend, and I was praying as I normally do about 5:30 in the morning, and something just hit my spirit and said, see, I always provide for you before you need the thing that you need.
Yes.
You didn't even want to touch that thing. But now it was already in your presence. And had you been using it, you wouldn't have to have this crash course in 3 days on how to work it. But thank God I provided for you to have it. So, so those are the kinds of things that we've done. We've done also, we have seniors, as you mentioned, we have many seniors in our church who technology has been a challenge. And so putting the services on thumb drives and setting up Kindles and sharing them with them, that they might be able to watch the services. All they have to do is press the button, it's already tuned up, and then take back. Those are the kinds of things that have been instrumental, I think, in helping to produce and keep that hope alive. They want to be together, but they also are fearful. So trying to maintain that sense of go slow. I always tell, and all my messages would be safe, be healthy, and be kind to yourself and to others.
Thank you. Thank you so much. Thank each one of you for those, for just sharing your experiences and the wonderful work that you are doing. And in the line with each one of your stories, one of the things that came to mind for me is, well, we're doing such wonderful work. Will this work flow over into opening back up? This is a new normal for us now, using technology so much. What will that look like as we prepare to move forward? And let me just start with that. What will that look like as we prepare to move forward? And the other piece I want to add to that I probably should have said first is, how does this new technology support or help people cope who are not able to be at the bedside when they're losing someone? How do they cope with the wounds that remain open because we're not able to go through our normal cultural rituals. A lot of this has removed our culture out of it, and in the ways that we are used to. And how do we address those things as we move forward to regaining some level of normalcy, but very much new normal, because it will not look like it used to be. And Pastor Brady, will you have one service at church and then one service virtual? Or will you blend it? You know, what would that look like? I'm asking you a lot at one time because these are just things that can flow into our discussion. Thank you.
Well, I'm going to jump in for a couple minutes and say that we're just going to add to what we're doing. You know, we are preparing in our ministry to come back on June the 7th. So our pastors are sort of working that. The leadership team is working on that. And I've done some of my research to see kind of what other churches are doing, you know, the reopening of facilities. And I think you have to do a blend. You know, one of the things that we did was to have sort of an awareness campaign for our congregation, and we called it a virtual Zoom party, comeback Zoom party preparation. And so, you know, we had a mask and, you know, mask competition and all of that, but we wanted to assure the members that, number one, we're going to still abide by the guidelines that CDC in our state has put out for us for being safe and social distancing, what it would look like when you come back to church. And for those who still weren't comfortable, you're not going to be judged that you don't have faith because you don't come back to the building. You'll still be able to access the Facebook Live services that will go on simultaneously. We also are planning to release a video of, you know, when you come up into the parking lot, all the way through it's gonna look like throughout the services, how you're gonna be greeted. Hugs are no longer gonna be the way we, handshakes are the new greeting. What we look like with masks on, and that yes, you can sing with your mask on, you know, and so those kinds of things. How are we going to do the offering? So all the things where you would be touching things and those kinds of things, we are working out those pieces and educating our members that if you choose to come back, we're going to do everything we can to have a safe environment. But if you choose to stay home, it's still good because you're going to be able to be online, you know, for those services. As it relates to what happens with care delivery, and I think, Danetta, you wanted to know, you know, what is it going to look like going forward? I think telehealth is going to be bigger than ever in terms of how we continue to do virtual care. We've got some flexibilities from CMS to do telehealth and to bill for that. And I think that that is going to open the door up, not for us to close it after this crisis sort of tapers off, because I don't think it's going to end. We'll see some tapering. But that's going to open the door for more palliative care being done via telehealth, and hospices have already been creative trying to care for patients in nursing homes and working with their partners to look for ways to do that, you know, virtually, and to continue to provide the kind of support that folks need. So I'll stop there and pass it on to my colleagues.
Well, one of the things, let me interject quickly and comment in the chat as well, which I was going to mention, is that I know some churches as a first phase are looking at parking lot services where either the chairs are in the parking lot or the cars. Now in the urban areas, you know, the cars in the parking lot may not work too well, especially if it's a mega church. Like the one that I attend, but what it reminds me of is the old drive-in movies. So instead of having a movie, you know, big screen, you have a pastor at the front. So I'm sure that some of your smaller churches may be doing that in the community. Oh yes, revivals. Yes, Chris says revivals. Yes, yeah, absolutely. Thank you. Thank you.
Yeah, Danetta, we've had a couple of drive-in services, and those have been so much fun because you didn't get to see people. So it gave people we told them don't get out of your car, but just drive in. And so the pastor was up at the front, and the praise team, you know, sort of moved apart distantly, but still during the worship service. And so, you know, people would honk their horns during certain parts during the service. And they'd say, raise a praise, honk your horns. And so there'd be all these horns honking. And so it was really good, you know, so we've had a couple of those during this time. And you do get creative, and you do want to still create an environment where your people can sort of connect and know that they're not forgotten. So.
Thank you. And if there are any other churches that want to give Kindles for especially some of the seniors, Pastor Brady said, I'm sorry, Chris, said that they start at about $45. So that's not a huge expense, depending upon the size of the church, maybe. Oh. And Gloria, were you going to comment next?
Wow, I've just been taking all this in. I love the ideas of how people are using creativity to still stay connected. I definitely know, you know, that we as human beings, we need connection, right? No matter what, we need connection. And even though we're not physically able to connect, this is still a way to connect, and it's still touching our spirits and our souls. So I'm just excited to hear of the innovation that's going on to keep people connected and to keep them encouraged. And I love the idea of the Kindles, and you know, just how our elders, so many of them, I have elder friends, some, you know, probably, you know, 80s, 90s, in those ranges that I consider my play moms, you know, fictive kin kind of thing. And I just call, because some of them don't, I know for a fact, they don't have anything but their telephone. And so, and they're isolated. And that's one of the other things for ministry for me, is that I definitely make time to call them weekly and not rush them, and listen to their stories and encourage them, or listen to what they want to say about the pandemic and how whatever they're, you know, whatever they're imagining it to be, but just as support. And I found that they are so appreciative. I mean, they'll keep saying, thank you so much for calling me. Thank you just for calling me. And I'm like, you know, I can see the value in us making sure that we stay connected to those that may not be a part of a church, for example, or maybe in an environment where they don't have access to technology or someone to even teach them that. But if we know people, and we know people, then that's another way I think that we can keep people encouraged and connected, just by reaching out through the phone, the old school way, or even sending a letter. I've gotten letters. I've sent letters to people, old school, you know, writing, just saying, you know, I miss you, I love you, da da da. And that they'll call, and they're so grateful to get something tangible. So we can't touch, but we can still touch. We can still touch.
You know, it's very interesting how receiving a letter or a card in the mail means so much. Something there, right?
Yeah.
Let me ask you, Gloria, but put on your social work hat for a moment, and just and just will you comment on how do you see people being able to manage the wounds or begin the healing process from the wounded space of not being able to say goodbye to their loved ones or be with them, touch them, you know, like we once were able to do.
Right. Yeah, that's major. I believe, just based on from the literature, what we're seeing in the news, that the grief issues are going to become more compounded, that people are going to be hurting in much ways that we've never seen before, because of the fact that you can't grieve. And you know, whenever you have a loss, you have grief. Anything that is about love, if you loved anything, a person, it could be whatever it is, that if it's lost and you loved it, you will grieve. It's just a natural part of life. And so I kind of see it as internalized sorrow. that is happening, and that is going to morph into this externalized suffering that we'll need to, it's amplified grief that we're going to have to find ways, as creatively as we are to minister through our churches, ways to help heal, bring healing to people's minds and souls, because grief is something that it's very individualized. There's no right way to do it, wrong way, but it happens in all of our lives when there's loss. And so we, you know, I feel like one of the things that any of us can do to help, if someone has lost someone, that we can just let them know that we're sorry for that. We can't change it. I had a quote. Oh gosh, I can't remember what it is, but it was when death leaves a heartache no one can heal, love leaves a memory no one can steal. It's you know, so it's going to leave a heartache, but they have memories. And so what can we do to help them keep those good memories in their hearts and their minds? And it's just going to be challenging to do that, because we can't, hugging, oh my gosh, a hug is one of the most healing things that we could ever give, right? But we can't do that way, but we can still connect. And I think just being patient and being loving toward people and being available to listen and not talk, even if we stay on the phone with them and just say, I'm here, just if they cry, just being there in however way we can be. I think that's going to be what a new way we're going to have to learn how to help in through the pandemic, at least.
Thank you. Thank you so much. Chris, you know, I always leave you for last because call on you last because I feel that you have many people that will come to you who are grieving, who will want to know, well, what can we do if we can't participate in funeral services? What are some options? And we know, and I'll put on my clinical social work hat as well, we do know that if we do not address our grief issues, they show up in other ways in our life. And that is all stages of grief, not in any particular order, but all stages of grief we must go through and not be quiet with, because we don't want that disease to appear in our life psychologically, emotionally, or in our interactions with other people that we love. So as a leader, you know, your church members I'm sure are going to lean on you really hard to try to find solace and begin that healing process in some way. Can you speak to that a little bit? Can't hear you.
Sorry. So okay. Sure. A few things. I think as we talk about loss, we're not only talking about physical loss, but the manifestation of ambiguous loss. For members of mine who've lost jobs, who now have to make meaning out of what I was doing well, life was going well, my income was good, and now I don't even know what's ahead of me. The ambiguous losses that come from the sense of, yes, maybe it's secondary grief where it wasn't directly someone in my household, but I wasn't able to be with my family members. So yes, to all of what my colleagues have been saying. Some of the practices that I have encouraged with my congregation members, memory boxes. I particularly use this a lot with children when I do therapy with children, but it's beneficial for adults as well. Creating a memory box, not trying to move on so quickly, but as Sister Gloria said, allowing that process, whatever that is for you, and we all grieve differently. I think we need to make sure that we are aware that some folks, it'll be an outpouring of wailing and crying, but for some folks, it may be pouring themselves into a project. I was reading this morning about a gentleman whose wife passed, and he did not show much affect, and people were concerned about him. But what he did was he always talked about how much he disliked her garden, but now he's tending her garden.
Yes.
And so that is his way of channeling his emotions and his grief. And we know that everyone grieves differently. Some of the other practices I think that become crucial and we all can do. I've been putting together twice a month or once a month. I'll ask, sometimes twice, but once a month, I've asked members to send me pictures of how they're doing or what they're doing, and just putting a string of pictures together in a kind of a foray and adding some music to it so that they can just click it and watch. And one of our oldest members, who is 99 years old, who's in a nursing home, is healthy, sound mind. She starts off the foray and she ends the foray with a smile and telling everybody, you can do this. And so those are the kinds of things that become critical to the rest of the congregation, to know that this mother of the church is still praying. We've also seen, it's been a blessing for me. We have one woman who has just purchased cards and is just sending cards to people. We used to send cards for birthdays. Now she just sporadically sends cards out just of encouragement. One of the things that we've engaged in doing is twice a month now, especially with the inability, as you said, the physical distancing, because what I remind my people is that it's not social distance. We're still the church. We're still connected. It's
Right.
physical distancing. But we're doing a TGIF Zoom the first and third Fridays. And there's no agenda. It's just I open up the Zoom call. I tell folks, bring your snacks, bring your non-alcoholic beverage with you, and join us online. And it's been wonderful because it's given people relief. And for the first time, one of those seniors who I have in my congregation, 83 years old, is adamantly against technology, would not touch a computer, called in for the first time 3 weeks ago.
Oh, yeah.
And everybody said, oh, Sister Mabel. And they were just, and she felt, so she called me, she said, Pastor, I don't know why I was so afraid to do this. It was just a phone call, but it felt so good to hear the church members' voices. And so those are, freeconferencecall.com, those kinds of media technology that you can use that connect people that way becomes critical, I think, to that. Those become the kind of practices we have to cultivate, and not just now, but I think it will continue afterwards, because the trend has been set, the culture has been established. We know that after about 90 days, you do something for about 90 days, it's supposed to stick for a while. So those are just some of the things that I think become critical to the, and then as Gloria said, the listening, the empathetic being present, and just sometimes not saying anything, but just being there to hear. Becomes the most important thing.
I can say that during this period of time, I have so many people who know me and reach out for different things, but during this period of time, I have found myself having dinner over the phone with people who are alone and isolated, or who have lost someone, not necessarily due to COVID, but just being with them same time to connect in that way. One of the things I want to mention is one of our webinar attendants actually commented and said that she had a client whose church is asking for photographs via email from people who would like to be present for services. And then the church prints those photographs and put them on the pews. And then the pastor will do a video conference of the service with those photographs on the pews. That's a wonderful idea. Thank you very much for sharing that. So we have
Danetta.
Yes.
Danetta, I wanted to ask a question of Pastor Brady. We found also that our children and our youth, we wanted to also get them engaged because experiencing loss. Some of them, our graduates, we're going to do a drive. The new term is a pull-up graduation kind of thing. I'm learning the new terminology, but trying to do some things to support our children, our youth who aren't with their friends. They're used to doing Snapchat and all that kind of stuff. But we started doing a Saturday virtual social party for our elementary toddler group, with a Bible story and then also a Bible reading thing in the middle of the week, kind of Facebook Live event, so that mothers who may be home with small children and school's been out, to sort of help with that piece as well. I'd love to hear, Chris, what you guys are doing for your youth and your children. Just a little bit about that.
Sure. There's a great so we have done something I do called Flipgrid. You can Google this. Teachers are using it. I got it from teachers. Flipgrid, F-L-I-P grid, G-R-I-D. And it only allows you to put in about 1,000 words. So you can do a little short devotional, but you can add videos to it. And so what we're doing is using it as a way to be a conversation starter for families at dinner time. And I'm encouraging families to put the computer on, read the devotion at dinner time, as you said, and then play the music or play the little short video. You can go on YouTube and find biblical stories. Encouraging play dates and group sessions, as you were doing, becomes important. I think for our parents out there, one of the things, because I tend to focus in my therapy with children, is maintaining a schedule, even when school is out. And if you have not been doing that, to make sure you establish the routine, the schedules become important. Children need to know that there's still some, that there's still a schedule, there's still
Structure.
Yes, exactly, for the course of the day, and they need that in their lives. We need that in our lives, because it's too easy to kind of just lay in a bed forever or just get up and haphazardly do things. But the Flipgrid, I'm also inviting young people, and my 13-year-old son, I just turned 13, who is now giving me the shrugs and the shoulders and all the. But what we've invited our members to do, and particularly young adult members and youth members, is they all have iPods and iPhones or something, or some kind of smartphone, to read a piece of the liturgy for the service on Sunday, send it to me, and then I put it together as one service. And so they're also still participating in the service. And so my son just had to read the song for his coming Sunday for Pentecost, and you know, he did it. Didn't smile, but he did it. But I think those are the things of still recognizing and involving actively in some kind of way, as you mentioned, the gathering and even eating at dinner time. That is critical that we maintain that. And then just doing play dates for my daughter, who's 8, and you know, she misses that. She's second grader. She misses that interaction. So.
And let me add a couple of things to that. I help coordinate Saturday church school at my church. And so our pastor did a dance-off on Zoom. Nice. We actually handed out pizzas from Little Caesars. They gave us a discount on pizzas. And we stood out in our mask and allowed drive-bys to pick up a pizza, you know, within a certain amount of time. And then they went home and we gave them a flyer with the pizza that had the Zoom information on it. And they went home and signed on to Zoom. We handed out a packet with the flyers and those light sticks that you break and they light up. Mm-hmm. And they went home and we had them to turn off their lights, and they had a dance off using their light sticks. So that's one of the things that we did to bring them together. And the other thing that we do is we are using Google Classrooms to hold. We're doing a virtual Bible sessions, and we upload curriculum materials and different activities so that they can actually pull it down at any time. And we also will have them to connect as a group, not consistently every Saturday, but a couple of times a month. Yes.
One thing I wanted to add too, for our seniors, I think this is important because I have a strong, probably about 60% of my congregation is over 65. So our Sunday school, and I'm not doing the Sunday school, we have Sunday school teachers, but freeconferencecall.com, they don't have to use a computer. You just call in. That's right. And it can be led by somebody. So everybody uses the phone. You may not want to touch a tablet, you may not want to use a computer, but you know how to use the phone. And the Sunday school has increased exponentially as a result during this time.
You know, one of the funniest things I saw when we opened up the virtual Saturday church school was we asked a young man to read. I think he is 14 now. He was laying across his bed with a sweatsuit on and his Bible, you know, reading. And, you know, we were looking like, are you laying down reading? However we can get the things is how we get them. If you want to lay on the bed, it's
well,
fine.
you know, that's right. Doesn't matter how he gets in, it just needs to get in. This morning in my prayer time, I just felt impressed to send out a song video thing because I know they love music. So I sent it to their friends. And I was amazed, you know, because I thought they'd say, oh, BJ's mom is sending us spiritual stuff. Well, man, I got heart loves back from just about everybody on that text string. I think the song was by Jonathan McReynolds, Make Room for Me. And so it was such a wonderful melody, and I just felt so impressed to just pray for our youth this morning. And so that was just really great. But freeconferencecall.com, we use it a lot for our prayer calls, and people jump on and you can get a report to see how it's doing, you know, through the week. And so one other thing that I've learned to do during this time, our pastors were sort of stretching the leaders and said, listen, people need encouragement. I want you guys to do Facebook Live or recordings throughout the week just to encourage people. So, you know, I'm used to talking with folks, but I wasn't used to doing Facebook Live. That's a whole nother level of talking to people. And so I've done a few of those just sort of about what's going on in my day that day and encouraging people. And I have been amazed at the responses I've gotten just on, you know, doing a 3-minute Facebook Live thing with people during my lunch break here and there, of people saying, thank you for the encouragement. I needed that. It's good to hear it, you know. So it reinforces the fact that people are open to receiving that encouragement. I apologize. I have to jump off. I've got a 2 o'clock call that I'm actually and so I'm going to drop off just a little bit early, but I have so enjoyed our time together today. And feel free to email me if there's anything else I can do to help.
Thank you so much.
It's great to see everybody.
You. Thank you. Be well. Thank you. I know, Matthew, I know we're coming close to our time, and I know we were going to leave some a few minutes for questions. Sure. I don't know if you've had any to come in or not, but
there's been kind of a little conversation going on in chat. There was a lot of interest in the Kindle program that Pastor Brady mentioned. Can you talk a little bit more about that program and kind of like how you're actually seeing it through?
Sure. So what I did was I asked our young adults and youth who had Kindles or some kind of tablet. Didn't have to be a Kindle. Kindles just happen to be the least expensive tablet you can purchase. Sure. You can get a refurbished one for about $38 and a brand new one for about, like I said, $40, $45. Matter of fact, Amazon just dropped their price on them because of COVID-19. Okay. What you can do is you can download media to a SD disk, stick it in a Kindle, and and just prime it, and then you hand it through the window to the senior or whatever, and they just, you can leave it small instructions. Kindle was the easiest thing to use because it was the first thing I had as a tablet. So if I can use it, everybody can use it. And so it's more of just, pressing the button to make sure it's powered on, pressing the, and if you need to, you can already prime it and hand it to them for them to watch the service. And what we do is we try to, we had the service on Sunday. They get the videotape of the past service, and they're able to watch it on Saturday. And so they're a week behind, but they're still seeing the service. And that is what becomes important. But it's employing those young adults and students who already know how to use this stuff anyway.
Yeah, that's great.
Thank you.
Gloria, I just saw a note in chat that has a link to your Facebook group. I think it just went to the panelists, but I can send it out to the full attendees if you like.
Sure, that would be great. Thank you.
Thank you so much. I was going to ask you how to get your information. And Gloria, you mentioned 2 other things that one is the Facebook group.
Right.
And then you mentioned a couple of writings that you've completed. Are those published, or how can we get access to those resources?
There, can you still hear me?
Yes.
There's a few, few of the personal reflections on my website for heart tones. I can tap that in there too, but it's a blog. So those are there, and that's free. There's prayers there that are free, that are personalized for you to say with your families, things like that, those types of things. But I also wanted to share a poem I wrote for somebody who had passed away. They didn't get to say goodbye, and it's called As I Say Goodbye. And
okay, just a moment. I want to actually close out with your poem, if you don't mind. I think that would be a nice way to close out. I really appreciate all of our viewers today. Matthew, I believe you would probably tell them to go to our website at practicalbioethics.org and look for our COVID pandemic resources for further information. This webinar will be there. And will it also be on our YouTube channel?
It will be, yeah.
It will be on our YouTube channel. And when you go there, please subscribe to our YouTube channel and view some of our individual videos as well. Thank you so much, Dr. Gloria, Pastor Brady. I so appreciate you being with us. The information was rich. I love the conversation. Matthew, thank you. I wouldn't have been able to handle all this tech stuff without you. So, Gloria?
yes, okay, this is a real short poem, but it was for someone who's grieving and who didn't get to say goodbye. It says, as I say goodbye, deep inside there is an intense yearning to touch you once more, to be with you. I know that time alone becomes my comforting friend. In moments like this, I realize how valuable the simple things in life really are. A burst of laughter, the quiet gaze of a sunset, the gentle squeeze of a hand. It's tough right now, trying to cope without you. I can almost hear you whispering peace to my soul, telling me to hold on and to be strong. I know you'd want me to go on with my life. I'll try, but it won't ever without you. Thank you for being a part of my life.
Thank you so much for joining us. Please review this webinar again on our website. Be well, everybody. Enjoy the rest of your day and the rest of your week. Take good care.
Be kind to yourself.
Thank you.
Bye-bye.